Hello, good morning, afternoon, everyone. I'm really excited to dive into a topic that is absolutely central to what we do every single day in healthcare, understanding and preventing errors. So just think about it. Every time we interact with the patient, make a decision or perform a procedure, there's a potential for something to go wrong. And when errors happens in our field, in a healthcare environment, the stakes are incredibly high, impacting not just the patient outcomes, but also the financial health of the institutions. So today we are going to break down the nine common types of errors we see in healthcare. And my goal is not just to identify them, but to empower all of us with practical strategies or safeguards that we can implement right away to make our work safer and more effective. So before I move ahead, and I just want to give a credit to where from I get this idea. I was reading this book, Lean Systems, by Elizabeth, Sandra, and David. And in this book, they have mentioned nine types of errors. And after reading it, I realized that the same errors are applicable in a healthcare environment as well. So why not to use the same concept and sort of make something that is more relatable to healthcare professionals? And here we are. So if you're interested, you can always go ahead and read this book. This book talks about various implementations of lean thinking in manufacturing, service, and healthcare industries. So, all right, so let's kick things off with forgetfulness or a memory lapses. That's the number one type of error. This is probably the most relatable error, right? We have all had those moments where even with the best intentions, something just slips our mind. In healthcare, just imagine this. A nurse rushed between patients, forgets to document a critical medication administration, or a doctor distracted by a complex case, overlooks a patient known allergy in their chart, prescribing a new drug. So these are real world, high stakes examples of forgetfulness. So how do we combat this? The key is to build systems that don't rely solely on the perfect human memory. And just think about it. Could be checklist. Just like pilots use a pre-flight checklist, we can implement pre-surgical checklist, medication administration checklist, or even patient handover checklist. So they act as a external memory aids, and so that you don't rely on individual thinking or a memory to do something that has to be done in a certain way. Another could be visual reminders. Sometimes just a simple sign or a visual cue in a treatment room can prevent a forgettable step. And it could be regular prompts, automated alerts in our EHR systems for, say, overdue tasks or upcoming critical checks. It can be incredibly effective as well. So this whole thing, by doing this checklist, visual reminders, and regular prompts, it's about creating a safety net for our brains, because in the end, we all are human beings, and mistakes may happen. Next up, we have a misunderstanding or a misinterpretation type of error. So this type of error often happens when we are pressured for time or when information is not perfectly clear. So we make conclusions before we're truly familiar with the entire situation. So assume the scenario, a new intern receives a lab result and he or she sees a value that seems off and immediately assumes a common diagnosis without digging deeper into the patient's full history or other related tests. Or during a, let's say, a rapid bedside handoff, a subtle nuance about a patient's condition is missed because the communication was not structured. And it may happen. So how do we tackle this? The answer lies in fostering clarity and encouraging thoroughness. So how do we do this? Let's say uh, number one could be through thorough training. So beyond just what to do, training should cover why things are done a certain way, building a deeper understanding. This also includes critical thinking skills, teaching staff to question and verify. Another is think of SPAR, the situation background assessment recommendation, kind of a checklist or approach for handoffs in a healthcare facility. This ensures all essential information is conveyed systematically, reducing the chance of misinterpretation. And it makes sure everyone is literally speaking the same language. So, moving on to identification errors or perceptual mistakes. So, these are about how we perceive things visually or through auditorially, especially when we are moving fast or the environment is not ideal. Now just picture this. You're pulling medication in a dimly lit supply room and you accidentally misread a dosage on a label because it looks similar to another. Or, let's say during a busy shift, two patients with very similar names are in the same ward, and without careful double checking, treatment intended for one is given to the other. So these are some grave concerns. So how do we safeguards here? So one is of course attentiveness. This might sound a little bit obvious, but consciously slowing down and focusing, especially during critical tasks like medications, preparation, or patient identification. Another is adequate lighting and clear labeling. So simple environmental fixes, can make a huge difference. Let's say in a medication room in your ward, if you just have a proper lighting. So it will ensure that the labels are clear and can be read in a clear way. So we need to ask questions. Are our labels clear? Are they large enough and standardized? Or is our workspace well lit? The third is double checks for patient identification. And I would say this is non-negotiable. Two identifiers always. Barcode scanning for medications and procedure is another powerful tool to eliminate human error in identification. Now let's talk about lack of experience or novice errors. So we have all been there at the beginning of our careers, feeling a bit, overwhelmed, and newer operators, whether they are new nurses, residents, or technicians, simply, have not built up the necessary practical experience to handle every situation smoothly. Now let's assume a common scenario. A newly graduated nurse might struggle with a complex IV insertion on a difficult vein, whereas a seasoned nurse does it almost instinctively. Or a new resident might miss a subtle diagnostic sign in a patient, imagining that a more experienced physician would immediately pick up on. So it's not a lack of intelligence, but a lack of exposure and refined skill. So how do we support our newer colleagues and prevent these errors? The first is we should have a robust mentorship programs. Pairing experienced staff with newer ones allows for direct guidance and real-time learning. The second is structured skill building workshops, providing safe, controlled environments to practice procedures and decision making before they face them in a high stakes situations. The third is a graduated responsibility. So don't throw them into the deep end. Gradually increase responsibilities as the skills and confidence grows. This also means supervisors have a role in overseeing and verifying initial work. So before I move ahead to the next, I would request you to, if you're listening to me, you can subscribe to this YouTube channel where I keep on posting on regular basis relevant videos related to improvements in healthcare. How can we use different tools and concepts and methodologies like Lean and Six Sigma? So here's a barcode. You can scan it and you can subscribe to the channel so that you don't miss the videos that I'll be posting on regular basis. So let's move to the next one. And this next one is a bit different. Willful errors or rule breaking. These are errors that happen when someone consciously decides to bypass a rule or a protocol. even if they know it exists. They might think they know a faster, easier, or a better way, or they might just feel the rule is unnecessary in that specific moment. Just think about it. Skipping a crucial hand washing step because someone is in a hurry. Now, bypassing a safety alarm on a pump, because it's always beeping, or let's say deliberately cutting corners on documentation because it feels a tedious job to do. These kind of actions, while sometimes seemingly minor, can have a cascade effects on patient safety. So how do we safeguard against intentional non-compliances? First is strong safety culture. This is paramount. It's about fostering an environment where safety is truly valued and people feel safe to speak up about violations without fear of, some kind of retribution. Second is clear rationale behind policies. Just putting policies is not enough. When staff understand why a rule exists, it's a direct link to patient safety, they are far more likely to adhere to it. It's not just because we said so to do it. The third is accountability and corrective actions. When deliberate rule breaking occurs, it needs to be addressed consistently and fairly. This reinforces that safety protocols are not optional for anyone. Now let's look at inadvertent errors or absent-mindedness. This is a distinct from forgetfulness. Forgetfulness is forgetting a step. And absent-mindedness is when your mind is just, say, somewhere else. You're physically doing something, but your focus is lost in thought, distraction, or say preoccupation. So let's imagine you're preparing medications, perhaps thinking about a stressful conversation you just had, and you accidentally pick up the wrong vial, or let's say while moving through the ward, you accidentally discard an important patient sample because your mind is, wandering somewhere else. So these are not intentional, but the consequences of a lack of present moment focus. So how can we minimize these unintentional slips? First is encouraging mindfulness, promoting practices that help staff stay present and focused during critical tasks. So this might involve some structured breaks or simple, say, focusing techniques. Second is minimizing distractions. In critical areas like medication rooms or procedure areas, can we reduce the noise, interruptions, and any non-essential conversations? The third is work standardization. By making tasks routine and almost like a muscle memory, we reduce the cognitive load, making it harder for our minds to wander off course. And this is about building habits that are hard to deviate from even when distracted. So our seventh type of error is delays in judgment or a hesitation errors. These errors are not about doing something wrong, but about not doing something in a timely manner. Hesitation, especially in rapidly evolving situations, can have some dire consequences. Let's say a critical example, a patient condition is rapidly deteriorating, showing signs of sepsis. And let's say, but a healthcare professional hesitates to call for a rapid response team or escalate the issue to a senior physician, hoping the situation will improve on its own. Now, this delay can cost precious minutes or hours, impacting patient outcomes. Just think about it. So, how do we foster timely and decisive action? First is enhancing clinical reasoning skills. Through simulation training and case studies, we can help staff develop the ability to quickly assess situations, prioritize, and make sound decisions under pressure. Second is promoting timely consultation, creating a culture where it is encouraged, not feared, to seek a second opinion or expert consultations when unsure. The third is clear escalation pathways, ensuring everyone knows exactly who to call, when to call them, and what information to provide in an urgent situation. This removes ambiguity and reduces hesitation. The next, we have a lack of suitable work standards or systemic gaps. Now, this type of error points to a broader organizational issues, not necessarily individual failure. It occurs when they simply are not clear, effective guidelines or instructions for how a task should be performed. Now just consider this. A new piece of medical equipment is, say brought into the hospital, but there's no clear, easily accessible instruction manual or a standardized procedure for its operation. Or in an emergency, different teams respond in a different, uncoordinated ways because there's no standardized protocol for that specific type of event. Confusion and errors are almost inevitable. So what's the solution here? It's all about clarity and consistency from systemic level. So you need to sort of develop clear, concise work instructions. This needs to be easy to understand, follow, and readily available. They should be like living documents, updated as processes evolve, not sitting somewhere in a portal where actually nobody looks at them, nobody reads them. The second is implementing standardized operating procedures or SOPs. For every critical process, there should be an agreed upon, documented way of doing things. This reduces variability and ensures consistency across shifts and personnel. The third is accessibility. As I said, it's not enough to have the standards. Staff need to know where to find them and to be able to access them quickly when needed. So, everyone, we have navigated through the nine common types of errors in healthcare, and from those momentary lapses in memory to unexpected equipment malfunctions. What I hope you to take away from today is not just a list of things that can go wrong, but a profound understanding that errors are really just a single person's fault. They are not at all about individuals. They're rarely about person's fault. They are often a symptom of complex systems, environmental factors, and a confluence of small contributing elements. This means that building a safer healthcare environment is not about blaming individuals. Instead, it's about creating resilient systems that act as safeguards, making it harder for errors to occur and easier to catch them when they do. Every single one of us in this room plays a vital role in this. Whether you are at the bedside, in administration, working in labs, or managing equipment, your attentiveness, your adherence to standards, and your willingness to speak up are critical layers of protection for our patients. Let's commit to fostering a culture where we're continuously learning from mistakes, openly discuss near misses, and proactively implement the safeguards we have talked about. Our patients deserve nothing less than our absolute best efforts to ensure their safety and well-being. I would like to thank you all, and I would encourage you to subscribe to this channel. Thank you. Have a nice day.